right, so tell me about your last couple of interactions with the healthcare system, whether it was with your physician or picking up a prescription at the pharmacy. Were those experiences positive, negative? Were there aspects that made you think there's a better way?
I've been pretty lucky. I don't have a ton of patient experience, but certainly with my parents and my family, we've had quite a bit of experiences of hospital systems or primary care providers. And I think recently going through some transitions with my mother of who her primary care doctor was, and switching from one physician assistant to another, and how seamless that transaction can be, and some of it was. And so, I look at her patient chart, and that information was passed over very, very smoothly, and patient records were available, and I look at some of the products we provided that help with that exchange. And
Sure. And you are a PharmD.
Correct, yes.
So my understanding is that pharmacists can play a really, really critical role in everything from adherence to lowering costs. What prevents pharmacists from fulfilling that role as a true part of the care team?
It's competing demands. The pharmacist is at a very interesting point in the patient's journey for healthcare. They've already gone through, they've probably seen a doctor. They've probably had labs taken, they might have had to have an x-ray or some other test. And so by the time they get to the pharmacy, the patient's tired. It's been a long day. Anything that went wrong upstream has already gone wrong. And so part of it's just the willingness of the patient to have those conversations. Pharmacy inherently is usually busy. It's in a retail store. So, patient's comfort level to have that conversation with a pharmacist. And then the opposite side is really important too. The pharmacist has really got a lot of demands on them currently with making sure that they're on the right regimen. So, you think through statins, so cholesterol medication. Is a diabetic patient on one of those medications they should be on? They're assessed on those other pieces than just get the right pills in the right bottle. And so as you try and work through all of those competing demands, do you miss that last step of having that really insightful conversation with the patient?
They do want to come out from behind the counter and really engage on the patient level.
I'd say that's the most important thing to us. I would say, as a pharmacist who's practiced for years, you want everything you can do to be in front of the patient, have that conversation. If you can talk to them about, here's how the medication is going to react for you, here's what you can expect, you're going to have better outcomes. It's just a matter of where does that fit in your journey with other competing demands? Do they pull you away from that patient-centered, focused conversation you want to have? So if they say, would you like to talk to your pharmacist today? Your answer should always be yes.